has a lot of, thank you, Marvin, for that. The health sector is an area that where we actually use a lot of our emotional labor, meaning that the work that we do in this sector really heavily leans on or affects how we feel, because we're leaning in with empathy, we're listening to people, we're trying to take in what they're saying and deliver back to them in meaningful ways. We're assisting people, we're helping people. So really, when you think about the emotional component of being a professional in the health sector, you really, really are someone who needs to be aware of emotional health. But I will not delve into that because we have two excellent speakers today who I will introduce shortly. But before I introduce them, I would like us to take part in a short poll that is going to be on your screens right about now. If Marvin can put that. And what we want to ask you right now, the first question, please do fill it in. I can see we have 71 people joining us. Do you consider emotional intelligence to be an important skill for leaders? So you have a poll that's been triggered and you have several answers there. Please speak one. Do you consider emotional intelligence to be an important skill for leaders? The second question is, which leadership challenges do you have to confront on a daily basis in the workplace? So this will involve you typing a little bit. Give us an answer. Give us a short answer. It could be 1 word, it could be 2 words. Let us know what you think is a leadership challenge that you have to confront on a daily basis in the workplace. And the third one is just for us to align and be able to deliver to the expectations of the audience. What is your expectation from this webinar? What is your expectation from this webinar? Okay, we're going to give it some time, even as I continue talking. Take just 2 minutes, 3 minutes before we start, and we can see what information we are getting. So far, we only have a few people who have answered. We are at 15% of total attendees. If we can get more people coming, thank you. I'm seeing we have 20% of total attendees. Thank you very much. Let's keep that going. I can see we have quite a few answers coming in. If you've just joined us right now, we're running a poll that has 3 questions. It should be on your screen right now. The first question is, do you consider emotional intelligence to be an important skill for leaders? Let us know, the choices are there. And then we are asking for you to write for us a short narrative on what leadership challenges do you have to confront on a daily basis in the workplace. Could be 1 word, 2 words, a sentence. Let us know what that is. And then the third one is, what is your expectation from this webinar? And this really helps us align with what you would want us to cover during the webinar, even as we have prepared some material from you. And I'm seeing as we continue, there's still other people writing where they're coming from. We still have more people from Dar es Salaam. Dr. Lufunyo, welcome. Thank you very much for joining us. Comfort, Alex, we even have a Comfort Sariem from Nigeria. Welcome very much. So we have the West, the East, the South, very well represented. I'm wondering whether we have the North. Very good question. Do we have the North? And thank you, Maureen, joining from Kenya. I'm seeing we have about almost 50% of of the participants are responding. I would like to see if I can push that to just 60%. If you haven't already answered the poll, there should be a poll on your desk right now, or rather on the, if you're using a phone, it should be the thing that's on top of your Zoom. And if you're using a laptop or a desktop, you should be seeing it. And the questions that we are asking are 3. And the first one is, do you consider emotional intelligence to be an important skill for leaders? Second is, what leadership challenge do you have to confront on a daily basis? And the third one is, what is your expectation from this webinar? We have about 51%, 52%. We're almost there. Let's see if we can get to 60%. We have 53%. We're almost there. Thank you, Joyce Mushiri, joining in from Kenya. Thank you, Luke Barasa, joining in from Kenya. If you have just joined us, we have a poll that's going on. It should be on your screen right now. We have about 59% of the answers. Thank you very much. Let's take it to 60. Let's take it to 60%. We have Anne Mumboa from Kenya. We have Pauline from Mombasa. We have Michael Owuma from the chairperson of Global Health Association of Kenya. You're very, very welcome to this webinar. We also have Monique from Kenya. Thank you very much for joining us. We're at 63%, so we shall close this webinar in the next 5 or 10 seconds. We have about 10 seconds to go. You're still filling in, just keep filling in. Yes, 10, about 7 seconds. Paul from Cameroon, you're very welcome, Paul. And Simon Maragia. And Rahma from Zanzibar, David from Kenya, Willie from Kenya, and Sarah from Kenya. Thank you very much. So we'll shut it down in about 5 seconds. So 5, 4, 3, 2, and 1. So I think we can end the poll. And the poll, thank you. So thank you very much for participating in that poll. We are sharing the answers that you have given us. And if you can see that, we have about, I don't know if you can see it, but I hope you can. We have about 99% giving us the answer to the first question. Do you consider emotional intelligence as an important skill for leaders? That was a single choice. We had quite a few people answer it, 75% of you. And we had, well, there was 1% that said, no, it's not necessary. And I do hope that at the end of this discussion, we shall be able to demonstrate just how necessary it is to have EI. But anyway, that's why we're here. That's why we're having this discussion. And then what leadership challenges do you have to confront on a daily basis? That is something we're just going to download right now. Maybe Marvin, you can send us as a document on the chat so we can see it, and then we will be able to discuss it further, as well as the question of what is your expectation. So we're just downloading that right now. So as we get that document, allow me to stop sharing the poll and really introduce the topic for today, where we're talking about emotional intelligence for leaders in the health sector. With me today are 2 persons, well-renowned in their spheres of influence, who have come today to talk about what is emotional intelligence and what does it have to do with leadership in the health sector. The first one is no stranger to a lot of us, and her name is Honorable Cecily Kariuki. And she is a certified executive leadership coach and a certified emotional intelligence practitioner. Additionally, she is a mentor, an author, and an accomplished policy, political, and strategy advisor. She supports leaders who desire to move from good to great and from great to excellence, drawing on 30 years of lived leadership experience across the diverse sectors and geographies. Cecily journeys with her clients as their confidant and trusted sounding board. She has held senior leadership roles in both the private and the public sectors, and she served with distinction in the Kenyan government as the cabinet secretary in various ministries, including health. She has coached and mentored several leaders, including ministers, CEO, doctors, and has served as a director for various international boards and expert panels under WHO. I know she has a very huge, huge passion for the healthcare industry, where she served for quite some time, and it is a pleasure to have her on this webinar. Welcome so very much, Honorable Cecily Kariuki.
Thank you very much, Vicky, and good evening, good afternoon to all of us from wherever you are tuning in. I'm very pleased to be able to share this platform with Dr. Dirango and yourself, Vicky, to advance a subject which has become a passion of mine lately for several reasons. One, because having gone past the health sector in Kenya, that patch gives you a chance to interrogate really what your leadership is about and how can you be able to improve your leadership and impact? And therefore, I did a 360 to come back and out of my lived experience to come and say, so what is a missing part? Leading all right. How can we humanize leadership, particularly, as you've mentioned, for people that are working in very emotionally charged spaces like health? And therefore, not just a passion, but a place where I do believe a lot of us can benefit by just learning a little more about what emotional intelligence is about and its place when it comes to performance and the connection between technical competencies and emotional intelligence in terms of improving performance in the workplace, in our personal lives, but even in our homes. And therefore, without further ado, I'll ask Marvin to get us started. I have very, very few slides
Okay.
that I'll be using to take us through.
Okay, Marvin, over to you. Just a reminder to everyone, if you have any questions, please put them on the chat. I will be writing them down. You can also put them on the Q&A section that you find on this particular webinar, and we shall have them answered as we go along. Thank you.
Marvin, let's get going on to the next one that I think is a known brand. So allow me to start from the basics and interrogate with you, what is EQ, the emotional quotient, also referred to emotional intelligence? I want to use Goldman's definition that he coined as he went ahead popularizing emotional intelligence in 1998, which is variously referred to as the ability to understand one's own and other people's emotions, to be guided by these emotions, and to skillfully regulate one's emotions and interactions with others. Now, for a moment, I want us to take this journey together. So an event happens. The immediate place where that is reflected is your emotional brain. And the emotional brain, which is also referred to as the reptile brain, will respond into one of the two ways. One, if you feel like the emotional brain sends a trigger to tell you that the event is useful and that there could be a reward forthcoming from the event, chances are you will get into a state of emotion that gives you satisfaction, that reflects meaning, that makes you feel valued and also useful. But if it was to go the other way around and the event was one that sends fear to you, you sense a threat, i.e. a building crashing or a boss that didn't have a very good night's sleep, shouting at you, immediately you get to office. Here, the response through the emotional brain will be one of concern. You'll get worried, frustrated, or even stressed. And then this is transmitted further from the emotional brain all the way to the thinking brain. Goldman defines the brain as having two parts, the emotional and the thinking brain. So once it gets to the message gets onto the thinking brain, again, one of these two things will happen. One, on what appears to be a rewarding situation or emotion, you become more creative, you tend to get more engaged, you get to have a more lateral viewpoint and wider perspective to issues happening around you. The opposite would be happening when you're in a situation where the emotional brain gives you a signal of a threat. You become disengaged, you become limited. Your viewpoint is narrow and you couldn't care less. The import of this pathway of the brain is that the thinking brain then moves you to a point of how you make decisions, following the same pattern that I've walked you through, and which decisions also cause you to behave in a certain way. And we'll delve a little bit around this. But effectively put, is that the event has triggered a pleasant or an unpleasant emotion. And quickly, this doesn't even allow you to think through logically. Now, the prefrontal cortex interprets this event, as it were, and then progresses you in terms of the feeling that you acquire. Both the emotions and the feelings that you then get will influence how you think and how you make decisions. Finally, how you behave or respond in whichever situation. Let's move on to the next one. So I think the takeout of this introductory session is for us to be able to be conscious that emotions will almost always influence the decisions that we make, the behaviors that we make, and thereafter the performance of either your organization at the individual level or the team you lead or the organization that you're leading. I base my analogy on Genos. I am a certified EQ practitioner under Genos, a company that is dealing with research, assessment, training, and also has become an authority in the EQ issues globally. Let's move to the next one. And so why is EQ important? And why is it important particularly now? And what is research saying to us? Again, using the Genos model, I want to just juxtapose EQ against effectiveness in leadership. And I want to cite research findings by Maya, Salovi, and Caruso, published in the year 2000, where they opine that emotional intelligence is a key determinant of effective leadership, and that emotionally intelligent leaders have the capacity to promote effectiveness at all levels in organization. Research that is well documented and that is quite available lately does indicate that for companies, if you're in the commercial or business side, that have embraced emotional intelligence and embedded that into their culture, day-to-day practices, records upwards of 20% in terms of profitability against companies that are dependent upon competence-based intelligence. And therefore, just to summarize what Meyer and Salovey Caruso are telling us, is that there is that direct link, as I have already exhibited in the neuroscience of emotional intelligence. Emotional intelligence concepts are fundamental to healthcare. And there are many reasons, and my colleague will be delving a little deeper into why healthcare. But research does show that EQ is becoming increasingly regarded as having an impact on medicine, the way we know it, nursing care, other healthcare disciplines, including pharmaceutical sub-discipline, where there is research based on studies that were conducted in Sanofi. But importantly, the question of self-leadership that hasn't been quite discussed a lot, because, for you who went to medical school, you know that your first call of duty is to take care of the patient, to take care of the people around you. There hasn't been too much emphasis in terms of how about you, the person taking care of the patients. Research does demonstrate that emotional intelligence is a major factor which marks out individuals as either effective leaders and innovators or otherwise. Emotional intelligence also can equip leaders to address some of the challenges that health sector is currently facing. Like I did indicate, this my colleague will be speaking to in very micro details. But for me to just take a reflection of my experience when I worked with the teams in the health sector as a cabinet minister, but lately when I have found myself working with CEOs and professionals and other leaders in the health sector, I reminded of how complex the health system is. I'm reminded of how fragmented it is and continues to be, how volatile the system is, but importantly, how competitive it is also becoming with higher client expectations. Days are gone, I recall, when I followed up with a doctor in a public facility in my earlier days, and the doctor was quick to respond to me in a manner that will never leave me, because he said, there is no case here. Hapa hakuna kesi, sio kotini. There is no case here. This is not a court of law. You know, I was following up on the diagnosis of my sister who I had taken to see the doctor. Days are gone that a doctor will not be able to respond to that, because then we are told access to health and good health care is a human right. There is more complexity coming out of, and uncertainty coming out of the public health emergencies that we continue to witness. The global one that shook the world being a COVID. Then I was at the tail end of my duty as the cabinet minister for health, just as I was exiting to water. And we all know what happened, the lives that we lost. Literally every family got affected in one way or the other. The burnout levels that the medical teams experience, the frustration that we experience because we couldn't move, but we couldn't also give solutions in good time. Other emergencies that have been documented, we are currently dealing with Mpox. We've been dealing with Marburg not long ago. As I went into the health sector, we had just gotten over the Ebola menace. And the next one will be happening given the changes in climatical conditions, the tampering that we are seeing in terms of everything else. And finally, because of the expectation against a shrinking resource basket, financial, but also where the human resource in health continue to be completely undermined by various reasons in the continent, immigration, but also our inability to put them at a level that they are well incentivized. Yet again, we insist that the doctors and the other health professionals need to mind the patient's care and give them the optimal best that the world can give. And so what research says, and I'll be coming to that, I again want to ask you to come along with me. What the graphic on the right is presenting the model that we use, basically showing the competencies. When you speak about somebody who is emotionally intelligent on the higher scale, or one that is lacking in terms of the emotional intellect, we will use that framework. There are different frameworks, but we subscribe to this particular one by Genos. And so just very quickly to show you why it is important for us to progress this conversation, is that if you look at the middle, which is what we call the emotional intelligence for purposes of a demonstration, there are 6 competencies that we'll be looking, and hopefully after this conversation, inviting you to take an interest in and begin to develop. The foundational one is self-awareness. By any name, in any other model, you find self-awareness being the most foundational or the anchor to the other competencies. And here, depending on how you show up, or depending on your level of EQ, you're either going to present one of these 2 situations. One, you're either present as a leader or you're disconnected. And there's meaning to that. The positive where you want to be as a leader or as a professional is to be present. And here, if we want to delve a little bit and say, so what is self-awareness in terms of definition? Simply put, is your capacity to identify your own emotions and to be aware of the impact that these emotions would be having on your decisions and behaviors. We've already looked at the pathway of the brain. And so you want to be present, meaning then you're able to modify your decisions and behavior towards a positive outcomes. The next one that follows in the same order in most models is awareness of others. And here you want to be in the desirable state of being empathetic. Again, there's a lot of literature around empathy and what it does, feeling with others, as opposed to being insensitive, which is the ring that is inside. You don't want to work or to relate with peers or boss who is insensitive. So what does awareness of others really mean? And this, again, simply put, is your capacity to perceive and understand the emotions of those that you're relating with, your peers, the people who report to you, your boss, your family, your colleagues. And the third competence that you're looking to develop or to enhance is authenticity. Authenticity, again, has two sides like a coin. You want to come across as being a genuine person, genuine leader, a genuine peer, a genuine colleague, as opposed to being in the negative state of being untrustworthy. Now, what does authenticity mean in real terms? This is your capacity to effectively express how you feel and facilitate authentic dialogue with those around you. Your ability to express how you feel means, for example, on a bad day that you had a sick child last night, and yet you have to show up to chair a meeting. You may want to be in a situation such as that, but request a colleague to either co-chair an important meeting with you or to altogether take over. You're being authentic. You're human, and therefore some of the negative vibes that may affect how you relate and influence the people around you will call you to put measures and mechanisms that still don't project you to the side which is a negative side. On emotional reasoning, that is a fourth competence. Here, again, you're looking to be in the state of being an expansive leader as opposed to being a limited. Limited is exactly what it means, limited, narrow focus. You allow your emotions to hijack you. Little triggers get you off the floor, and therefore you want to be on the opposite side. So what is emotional reasoning as a competence about? This is your capacity to use emotional data that you have gathered from your self-awareness, where we started, awareness of others around you, and combining these with objective information for any decision that you are about to make. So logic here, facts here, research here, but bringing in self-awareness and awareness of others so that you come up with a more optimal decision as a leader. The fifth one is one on resilience. And here, this competence, again, growing in importance, particularly in the health sector, is a situation, resilient is a state, but the competence is self-management. Again, exactly what that means is your capacity to effectively regulate and manage your emotions. And here again, you want to be in a state of being resilient as opposed to being temperamental. And most of us have been treated to this, and in the health sector, this is commonplace that, given the stress levels, given the expectations, and given all the demands around the job, you're likely to fall short and move on to the other side unless your IQ has been enhanced to a level that you consciously keep on pushing yourself towards being resilient. Finally, the sixth one that we apply here is one of inspiring performance. How do you inspire performance? Two things will happen. Either you're an empowering leader or colleague, or you are indifferent and nothing bothers you. So inspiring performance here again is why you're looking to have the capacity of influencing the emotions of those around you by getting them to move towards a vision that you may have set or the goals that you have set for yourself. And therefore that, colleagues, is the model that we'll be using, that we have been using, and it helps you to delve a little bit deeper into the micro details of then what it is you can do with your IQ. Marvin, shall we move to the next one? Marvin, share the next slide. So what does research say? And here, colleagues, you allow me, I want to quote verbatim. I have moved away from the commercial aspects of what is documented, like I mentioned, in terms of the bottom line. I have moved away from also the return on investment for companies that are investing in IQ. And I just want to quote various thought leaders and authorities that have done research over time about emotional intelligence. And this is what Gomez in the year 2022 had to say. Leadership and emotional intelligence yields favorable outcomes for healthcare organizations. End of quote. That is research, is documented. Other thought leaders and researchers go on to say the following: the emotionally intelligent leaders are thought to perform better in the workplace. That is Goldman, the authority that popularized EQ 3 decades ago. Abraham, in the year 2000, went ahead to say emotionally intelligent leaders are happier and demonstrate more commitment to their employing organizations. Johnson and Idvik in 1999 averred that EQ leaders, emotionally intelligent leaders, are able to expand opportunities and channel energy towards performance. George, in the year 2000, is quoted as having said that emotionally intelligent leaders use positive emotions to envision improvements in the organization's functioning and instill a sense of belonging, enthusiasm, trust, and cooperation in employees through interpersonal relations. I want to underline interpersonal relations. Miller, in 1999, opined that emotionally intelligent leaders record greater success, again documented. Finally, Humphrey, must be the year 2000, indicated that emotionally intelligent leaders have the ability to influence the emotional climate and can propel employee performance. End of quote. And there is hundreds and tens of research that is confirming all this. But this, in a nutshell, colleagues, give us a sense and a feel of why EQ is important to be part of your skill set, to be inside of your toolkit as you move to either grow vertically or as you expand in terms of the responsibilities that are being put on your shoulders, or even just as you're struggling or trying to become better in self-leadership. It is said that you cannot lead unless you self-lead. So even if it was just about you leading yourself, then this body of research goes ahead to confirm the place. And I don't think I'll be struggling too much, because if 99% of the audience today has confirmed that you do recognize EQ to be an important skill for any leader in the 21st century, I'll rest my case by just observing that such leaders, and this is where the 99 of you belong, and the 1% will be coming along, I believe, by close of this webinar. Such leaders are better in managing the occupational stress and burnout to workers due to the emotionally challenging and physically demanding nature of their job. That is you in the health sector. Marvin? So finally, what are some of the proactive strategies would one be looking to embrace so that you can strengthen or enhance our EQ? Put in 5 categories, but then again, you'll find a lot of different ways of interpreting this, but broadly put, the 5 buckets. 1 falls within the category of the thinking strategies. And here, the very basic one, that again is simple, very impactful, is you begin by identifying the emotions that you may be experiencing. And normally we encourage you to do so within a 24 hour time frame, and you actually journal, you record, classify the emotions. Are you sad? Are you happy? Are you gloomy? Are you angry? Are you excited? And there are all those definitions. Then you analyze. By analyzing, you're actually going to try and interrogate what could be the underlying cause of my feeling sad, my feeling angry, what's caused the frustration. And by so doing, you're halfway done. They say, and you're better placed to confirm these as clinicians, part of who are here, is that the correct diagnosis is halfway the solution to a remedy, a permanent remedy. The other one that comes with thinking, within the thinking category, just again, I'm just throwing in an example, is one on mindfulness. Self-care is a backside of mindfulness. Again, unless you know what it is you're running through, you've thought through, you've identified, you've classified, you've analyzed, can you then actually get a proper resolution to the emotion that you may be experiencing, particularly that which is negative? The other bucket is one of physiological strategies. And here again, different people, different measures, different responses. This is where you have stuff like deep breathing. This is where you come in with meditation, for example, yoga, exercising, music, those of you who like to dance, dancing, or just taking a lazy walk. The third bucket as a strategy to strengthen this is relationship strategies. And here again, relationship strategies. I think that recent studies are indicating that the world is becoming or growing in loneliness, that the index continues to grow. Just because we may not have time to relate the way our forefathers did, the IT shift has also come with its own challenges. After COVID, we were all told you could actually set your office where I have set mine at home, and it's as good, and I can keep relating with you on Zoom. Yet what that means is that we are actually tampering with relationships, human interactions. We are created to interact as human beings. And here again is just being deliberate about it. Go to networking events. Make sure, even though you're on Zooms, that you actually have in-person conversations or interactions. Go out for a cup of coffee. Be with the people that you love. Create time for them. Spend time together. And the fourth one is environmental strategies. Again, it's documented the things that you do when you're outdoor are therapeutic in nature. Go do what people do. If you're in Nairobi, go to Karura and do what people do. Tend to the environment. It will come to pay, by the way. And the final one is learning strategies. And here I would speak about the need for us all to enhance or increase emotional literacy. We are struggling because while we know something called EQ, it's been challenged by a few, but really it's working. And, I'm a witness. I mean, I am completely a witness. The literacy levels of emotional intelligence remain quite low. It is documented in research that only a third of leaders globally today are emotionally intelligent, a third, 36%. So you can begin to imagine everybody else is on the other side. Some know that it is useful, but they, amidst priorities, your very busy schedules may not allow you to actually, embrace and deepen or strengthen. I'm encouraging us to look at these by doing one of the following of a combination, getting mentors who are ahead of you in terms of the EQ, as a discipline, get coaching, over time, work with people who are able to begin with you at the baseline, do an assessment of where you are at in terms of the competencies, and come up with a plan, a development plan that helps you to go through practicing enhancing, and checking back that you are strengthening your EQ. Training all available. This is what Vicky and I do for a living, as well as coaching. But there's also reasonable, literature that is credible that we are able to access to be able to read. Is it easy to read or to just learn and do? My answer is no. It will take practice and more practice and more practice. Meaning you got to be very intentional that yes, here is a gap, here is the benefit, here are the benefits, and this is a pathway that I can be able to enhance or strengthen my EQ. Beauty being that it is not an innate skill, that it's learnable with effort and intentionality. And finally, Marvin, I go to say I appreciate you for your attention and the time that that has been appropriated, and we will be able to respond to your Q&A. To your questions at these other sections as Vicky may guide us. Thank you very much for your attention. I have shared my contact details in there. Most of you, I think, may already be having the contacts. And I'm also on social media, LinkedIn, on Facebook, and you could reach us as we'll be guided at the end of this session. Thank you for your attention.
Thank you very much, Cicely, for that short, succinct, yet very clear way on how emotional intelligence is effective. And I've seen some comments coming in about the discussions that we've just had around emotional intelligence, around the health sector. And I've also seen some questions, but I would like to take these questions at the end and first listen to Dr. Dirango, Dr. Meshach Dirango, who is a public health leader with over 25 years of experience. As the country director of AMREF Kenya since 2015, he leads a team of over 400 staff, driving strategic, people-centered health innovations tailored to Kenya's needs. He's a credentialed executive coach, and he also founded Coach Links, fostering client-coach connections. In addition, he has co-authored Career Choice, and it's a book inspiring informed career decisions for youth. And I know he's also very passionate about this space, about coaching in particular, and I think the Coach Link organization has brought together very many professionals to be mentored, to be coached by each other. And I think this is a topic that for him is also close to his heart. So I want to welcome Dr. Dirango and Jofi. Thank you very much for being on the platform, and let's listen to what you have to tell us today.
Thank you very much, Vicky, and good evening all. And once again, thank you, Honorable Cicely, for starting us off on a very on the science and also the practice of emotional intelligence. Building on what Honorable Cicely has put on the table, I would like to paint a picture of the pain points that we experience in the health sector. And it's a sector that I've been for more than 2.5 decades. So I also speak from experience all the way from the district to the national level. And I would like to highlight 6 pain points that I feel could resonate with us. Next slide. Next. The very first pain point that I would like to highlight is in the health sector is leading under pressure. And I would like to start by asking us a question. What does it mean to provide leadership, effective leadership that empowers, inspires, and drives impact in our sector? This question is especially relevant to us because the stakes are usually quite high. Now, imagine you're leading a team through a crisis, and we usually face those at micro and macro levels, as Cicely brought out. Could be a disease outbreak, a medicine shortage, patient safety issue, a team conflict, or even a major budget cut, and you still need to deliver. You can think of any high pressure issue that you face and that is relevant to you. How well do we recognize these as moments or opportunities to strengthen our abilities at adaptive leadership, to be able to guide our teams, protect them from burnout, engage stakeholders, and all the while manage our own anxieties by applying the EQ skills or EI skills that Cicely has talked about. In such moments, a quote shared by a colleague, Robert, and I hope he's in this webinar, becomes especially relevant to us, that building a team, building an effective team requires different ingredients, but these ingredients are held together with an abundance of emotional intelligence. It's like the glue that holds all these other capabilities that we do have, technical and a lot of other capabilities that we bring on board, being vision focused and all that. It is a glue. And thank you, Robert, for sharing that. So leaders who use emotional intelligence are able to unite teams towards shared goals, even in stressful situations, because they have this glue that holds the leadership capabilities together. Next slide. The second pain point that I would like to paint is the whole issue of dealing with tough feedback. And as Cicely highlighted at the beginning, there is no shortage of tough feedback, because when the stakes are high, it's also likely that things will go wrong. In the health sector, how do we handle tough feedback from our supervisors or elsewhere? Think about a time when your supervisor gave you difficult feedback, especially after a significant mistake. Personally, I've faced such in the past, and I've achieved so much growth out of those unpleasant feedbacks. How did that feedback make you feel? Were you angry? Were you grateful, disappointed, enlightened, guilty, pathetic, frustrated, relieved, anxious, or are you determined to become better? And afterward, how did those emotions shape your actions? Were you reactive or responsive? When we are reactive, we might feel frustrated, respond defensively, make excuses, or place blame on others, often damaging relationship and reducing team effectiveness. But when we are responsive, we embrace and manage our own frustrations using emotional self-awareness and all that. Ask clarifying questions using the skills Cicely talked about. Demonstrate accountability, which builds trust and team effectiveness. And colleagues, to lead effectively, we need to enhance our emotional intelligence capabilities to be able to transform tough feedback as feedback that puts us on a path to growth. How can we also build teams that welcome constructive feedback as a growth tool? Obviously, modeling this behavior is key. How we take feedback ourselves is key. But also tools like appropriate 360-degree assessment tools can help elevate the ability of teams to entertain constructive feedback and not always taking things personally. Next slide. I would like to go to the third pain point that I think will be very familiar, all of us will be very familiar with. Siloed decision-making. Let me ask us a question. How often do we reflect on what health systems truly mean? In fact, why are they even called systems? I know we are familiar with the various health systems components, whether it's financial management, human resources for health, equipment, community engagement, multi-sectoral collaboration, and the provision of services, which a lot of us are in. But these components must function in synergy, like links in a chain to drive health outcomes. And a health system is only as strong as the weakest link in any of those building blocks. When decisions happen in silos, health systems fall into what has been described as inefficient equilibrium, where we put a lot of effort, but the expectations are below what you would like to see given the level of investment, because some parts are broken. For example, consider the case of maternal health in Kenya. We know, or some of us know, and you can also check your country how things are. Skilled birth attendance in Kenya has gone up dramatically. Today, 9 out of 10 women deliver in a facility. But maternal deaths have still remained much higher than you'd expect when almost every woman trusts the health facility to go and deliver there. as leaders, how can we better support strengthening of health systems in ways that deliver good results? Are we empathetic enough to open dialogue, engage stakeholders, and foster an environment that's open to learning and free from blame? Are we prepared to coach others towards improving health service quality and create spaces for observation and learning to find solutions, for example, in areas of maternal health and any other area that you may be working in? Leading change is demanding and requires us to practice adaptive leadership. And adaptive leadership calls for self-awareness, it calls for empathy, it calls for presence, all those things Cicely talked about, to be able to build inclusive and collaborative teams. It's only through such teamwork that we can amplify the impact of our health systems, especially here in Africa, where we have limited resources, but we need to achieve so much results. I would like to go to the fourth pain point, so we can go to the next slide. And this is conflict resolution amongst stakeholders. What example can we give in our various countries about this? We have all seen, for example, the impact of health worker strikes on population health. As Honorable Cicely, I don't remember whether we had strikes when you were the cabinet secretary, but no doubt, I know you handled them very well. In Kenya, for example, maternal deaths went up during the 56-day strike that happened in early 2024. And when the cabinet secretary announced an end to the strike, there was relief across the country. Reflecting on this, emotional intelligence stands out as an important tool in every leader's toolkit to prevent or lessen the impact of such crises. For example, by fostering empathy and open communication, leaders can better understand concerns before they escalate, and proactive conflict resolution can help avoid such shutdowns that lead to severe outcomes, including loss of lives. Now, I have a question for you. In your organization, have you faced situations where stakeholders made demands that were impossible to meet? How did you, or do you handle it? If you are to build a leadership toolbox for yourself to address such challenges, which tools would you prioritize? Would you prioritize deepening your emotional awareness, being able to stay calm and remain focused on the outcomes that foster goodwill and commitment from all parties in such situations? It's almost impossible to achieve that without emotional intelligence, however much we focus on vision. This is a leadership that a health ecosystem needs. It's what we are called to, one that builds trust and applies diplomacy to handle complex challenges. Allow me to go to the next pain point, interpersonal relations and trust building. And Honorable Cicely also talked about this. Have you ever felt treated more like a machine than a human at work? Think back to that time, maybe before you became a leader. How did it feel? Were you dealing with personal struggles, family issues, or were your ideas being ignored? How did this impact your commitment in the organization? What could your organization or even your supervisor have done differently for you during that time? Now, as a practitioner of leadership, think about those people who report to you. How often do we engage them one-on-one? And how meaningful are those interactions? Like if you are to ask any of them on a scale of 1 to 10, how would you rate the sessions that I hold with you every month or every quarter or every week? As a leader, you have the opportunity, and we have the opportunity to enhance these connections by cultivating emotional intelligence skills. Finally, as I go to the final pain point, you can go to the next slide. And Honorable Cicely talked about it, the issue of burnout. Where is the place of self-care and the well-being for the leader? How often do we, or how well do we take care of ourselves? Have you ever felt burned out at work? The World Health Organization defines burnout as relentless stress leading to exhaustion, detachment, and reduced professional efficacy. In health leadership, avoiding burnout requires us to apply a holistic approach to healthcare. And as health workers, we often face burnout or compassion fatigue. And as leaders, we are no exception to that. At the core, colleagues, is to remember this, that caring for yourself enables you to lead others more effectively and also to lead a meaningful and fulfilling life. And to make progress on self-care, it's good to ask, what can we do? Start by creating what we call psychological safety in your team, where constructive feedback is accepted. On a personal level, prioritize physical activity, sleep, balanced meals, hydration, resilience, and all that. Set boundaries. If you can't limit after hours work, except in emergencies where we can't, and make time for families, hobby, and reflections. Practice mindfulness, the way Honorable Cicely said, and break down tasks or delegate as best as you can, or celebrating wins. Sometimes we forget to celebrate, and we're human beings. When we celebrate, we have the good hormones that give us resilience. And how can we commit to lifelong learning, like on EI and other capabilities? And finally, don't forget your financial health, because if your financial health, if my financial health is not okay, then a lot of other things come. So as I close, once again, to strengthen the health systems that we are leading in ways that improve population health, we need to deploy EI, or emotional intelligence, as one of the tools in our leadership toolboxes. And developing our EI skills will enable us to lead under pressure, give and receive tough feedback, foster synergy in our health systems, build trust in teams, apply diplomacy for stakeholder management, and ultimately, and finally, prioritize self-care for ourselves and our teams. And as I close, just to remind all of us that leadership isn't about perfection. It's okay where I am, where you are. It's about learning, sustained growth, and authenticity, being authentic and knowing that no one is perfect. Because even if you thought you're perfect, tomorrow you get a situation that you've never encountered. It calls for EI to have that intellectual humility to engage other experts and say, how do we find a solution to this? Thank you.
Thank you so much, Dr. Dirango. I think what you have talked about really brings it home. It really takes us back to the actual things that we face in our everyday living, our everyday habits. I mean, I've just thought about the collaboration piece, leading under pressure. And I can imagine in healthcare, there's constant pressure all the time to deliver, to make a decision. The decision sometimes is life and death, the stakeholders. I mean, really bringing it to the forefront of what healthcare professionals have to think about each and every single day. Wonderful presentation. And I think if anyone wants any more from Dr. Dirango, you can reach out to him and really listen to him, because he has got great insights about the pain points and what you can do. And then we have had Cicely, Honorable Cicely Kariuki, talking to us about what really is emotional intelligence and what are some of the things that we can actually do to improve our emotional intelligence. I like to say that emotional intelligence is not possible if we do not practice or start understanding the need to be self-aware and growing our self-awareness. And that's something that has been touched by both speakers as a huge need in terms of being able to grow ourselves as leaders, as coaches, as mentors, as people who are resilient in our workplaces. But there are several questions that are coming up that I think we need to address, and I will bunch them into two. I don't know who wants to take this up. I could possibly share the first one with you, Dr. Dirango, because actually someone has mentioned your name and said, when people own health initiatives, then it is easier building trust. Bottom-up institution building is more effective. What is your take on this? And then another one that I would like you to answer as well is, do we have synergies between academia and non-academic organizations for inclusivity of emotional intelligence to address bottlenecks in the health systems? Are there avenues for this? I'll ask you those two questions first, Dr. Dirango.
Thank you very much, Vicky, and also the colleague who has posed those two questions. If I start with the second one, the point that our colleague raises is important, that our training in a big way in the health sector has been hugely focused on the technical capabilities and not the ability to handle adaptive challenges, which calls for adaptive leadership. And so this is actually a call for training institutions for primary health care, public health, medical schools, and all that, to begin asking what are the modules that are being included in the curricula on adaptive leadership and other soft skills for leadership. The good thing is institutions like Amref Health Africa, we are already in 2025, we'll be introducing a short course on emotional intelligence that we'll be offering for several years. And after this webinar, we should be able to send you more information about that. You can register so that when the course is announced, you'll be able to be among the very first ones to receive the news about that. Yes, so, but it's a place for advocacy, for us to keep revolutionizing the training. I personally believe that 80% of the training can be technical, but 20% really needs to be about the soft skills of leadership, which is what we are lacking in our systems. On the second question about institutional systems or building our institutions, again, that is a core. And when you look at the health systems building blocks, is what we call governance. Governance is one of the 6 or so health system building blocks. And our ability to look at challenges, for example, whatever challenge you look at, whether it is the current UHC transitions in Kenya, or it's maternal health, or malaria, or any other problem, or the global health security crisis we face, as long as we only go and respond to the issue that 1 week or 1 month and go back to our homes, the problem will still find us. But as leaders, we have an opportunity to acknowledge what are our institutions for every challenge that we face. And I really would like maybe Honorable Cicely to deepen that. For example, when you talk about global health security, how well are we strengthening our National Public Health Institute, for example? But how well are we also strengthening the county emergency response mechanisms and looking at our laws, like how well are we subscribing to international health regulations and all that? But Honorable Cicely, having been a cabinet secretary, please deepen that. Thank you.
Vicky, would you like me to go? I can combine with something else.
Yes, I was actually saying, I was thanking Dr. for those wonderful insights and saying that, yes, you can take that question, but I'd also like you to cover a question by Mika on, which I think ties on very well to that, on the desire to solve health problems in Kenya. I think more to me is that what you see as the way or the path to solving the health problems and to capitalize on or not to capitalize, but to actually develop individual gains in that sector. And then the last one I would like you to answer is on Mercy. How do you balance authenticity and control? I imagine someone who has been in the public space, such as yourself, must have quite a bit of areas where you have to balance being authentic at the same time, controlling your reactions to the many different and obviously emotional triggers that you might receive. Over to you, Cicely.
Thank you, Vicky. The third one, which was the first one by Dr. Dirango, thank you for your response. I think there isn't too much to add, save to say that the developed world seems to have gone ahead as usual, ahead of Africa as a continent in terms of matters, reorganization of the medical school curricula and the training programs that are being given to professionals in the health space, because I'm aware of countries such as New Zealand, Australia, a little bit UK, that they have maybe 10, 15 years ago, they really did interrogate the place and benefit of emotional intelligence. And the fact that you know, the conversation around the productivity, the burnout, the stress, the patient care and the level of patient care and sustainability of the same competition and all these other global dynamics, what they mean in terms of the person who is at the center of delivering the service to the patients. And they have reorganized somewhat, and I think, Dr. Dirango, you may be aware. My vision and hope is that sooner or later, that we as a continent, we as a country will be coming back to actually say, you know, this piece, never mind we consider it to be a soft skill, is equally important as an anchor to a better positioning of the technical competencies. And that alone, you are not going to be effective in such a collaborative sector, in a sector which is frowned by several conflicts now, which is very volatile, where there is, you know, no stability whatsoever. And therefore, it is my hope that this will find its place, whether through the policymakers, whether through the advocacy, because what Vicky and I are doing right now is really advocacy, and appreciating you, Dirango, because if AMREF comes as a big institution, an African continental institution to embrace and locate these in terms of developing these as a skill, then you will be able to get many more coming. I'm also aware that some of our partners, you know, funding partners are very keen to actually have programs where we can embed these in training and be able to also have it delivered in a way which is not your usual classroom training setting. Research indicates that only 20% is retained when you go for training. 80% is a waste of time, you know, having a cup of tea and feeling good, and there's nothing wrong with that. And therefore, combining delivery of EQ skills by way of training, coaching, assessments, follow-ups, I think is going to get us there. I may be responding somewhat to one of the questions, whether there is interest. Is it, Mika, whether there is real genuine interest in terms of getting healthcare to the level that it ought to be? That's a very Kenyan question, as it were, and therefore just using my Kenyan experience then, is that, like I indicated, health is such a complex system. I mean, I've been to enough sectors to confirm that health is the most complex. And so complex, yet you're dealing with human lives. You're dealing with the risk of somebody dying or not dying. But obviously, if I was to flag out two reasons why I think we can do better, is to also say we have not even lived to the you call the Abuja Declaration in terms of the finances that is required from money that you get from taxes through government back into the health sector. I mean, we are not even a quarter way in terms of appropriating sufficient resources. And therefore, it becomes very difficult from a political point to say, how do you then deliver health really? Number two, health has become very politicized. And in Kenya, Dr. Dirango, that you'll know, devolution of health services went ahead of proper structures and proper infrastructure and proper, you know, human resource deployment. And therefore, you find gaps at the center, but also gaps, you know, in the counties themselves. But hopefully, the reason we are inviting the health professionals and leaders to be able to come and embrace EQ as part of their skill sets is because you can only give what you have at the micro level. You can only, you know, give good, consistent care if you are taking care of yourself. And therefore, the issue of self-awareness and self-care become very important, because if at the micro level, each one of us is able to do what it is we possibly can do optimally without burning out and without, you know, losing issues of emotional control, we can only make the sector better beyond where it is today. Vicky, I'm not so sure that I recorded the third question.
The third question was about authenticity and control.
Well, I recall, and it's just because as Dirango was talking, I was trying to respond to several of the other questions. There were quite many, and responding.
Yes, I can see.
But yes, if you are in the public sector, and that is where you're currently working, the culture of the organization in itself can be a bit of a challenge in terms of maintaining the sweet spot in terms of authenticity and control, because it's a very command and control environment. And if that is a culture you walk into, then depending on the level you enter, it will be very difficult for you to actually exercise authenticity, because here I'm the boss, I say you do as I say. But if you're to go into an organization at the same level where a psychological safety is a norm, where, you know, disagreements are not necessarily fights, but they are for finding a sweet spot in terms of the best perspectives and combining what everybody is saying, then you're likely to have a better balance between being authentic without being judged, and also ceding control, because then you are not in a control command environment. So it really depends on the context. It depends on the organizational climate. It also depends on the boss. But importantly, it depends on the situation, the contextual situation you find yourself in. For example, when COVID hit and we knew we had to close down, it was not tafadhali, ati we are requesting you, do we shut? Because then the situation was such that it was between life and death, exposing the whole population. And therefore, you minimize now, you're being very authentic for the season because of the prevailing circumstances for when an emergency such as that one is happening. You'll come back and explain, and you're going to recover your trust. But if you go and you're not able to communicate, or you don't come back again to say the situation was, and you all know there was this emergency, we had to make this decision. But in an ideal situation, authenticity should far much outweigh control. We are saying away with the control and command environment, even in situations where it is a public sector going forward. I saw a question, allow me, Vicky, to respond to this a little bit in terms of how somebody says the anonymous, they have quit because they have been harassed, because they've not been heard, they've not been listened. And I said, no. You don't quit because we all would have, gone off. The wheels always get off the rail if you don't have yourself some coping and supporting mechanism. That is where your mentor comes in. This is where your coach comes in. This is where somebody you can trust as a sounding board comes in, because you quit today, you may quit tomorrow. The world is not always a very fair place. But you also need to be able to know how to set your boundaries. The person who wakes up to be able to harass you right now, it means that perhaps you have not communicated to actually give them the signal and to say, what? Beyond this space, even though you're the boss, beyond this space, excuse me, so to be able to know your boundaries, to set them, to communicate them with respect, and to be able to hold on to your values. Vicky, back to you.
Thank you so much. Thank you, Cicely. Thank you, Dr. Dirango. We have a few more minutes. Would like to close promptly at 5:30. We did say 4 to 5 p.m., but I think we can take another 13 minutes to finish. There are two questions, and I want to ask the first one to Dr. Dirango, and then the second one I'll ask to you, Cicely. The first one is beliefs and EQ, Dr. Dirango. Can you speak about them? I don't know whether she meant, are they different, or what's the relationship? Maybe you can shed some light on beliefs and EQ.
Yes, thank you very much, Vicky, for that. And also, Honorable Cicely could deepen on that. I think when Honorable Cicely was talking about emotional intelligence, it really boils down to being able to have a control of the emotional brain, to have the thinking brain, the logical brain, having control over the emotional brain. You see, our limbic system, we have the emotional brain. I think those in the medical call it the limbic system. Honorable Cicely called it the reptile brain. So that's where our emotions are driven. And notice those emotions, observe those emotions as if you're observing them outside you, and manage yourself and others so that they do not hijack you. But now, beliefs is a lot of it also would come, for example, from our upbringing, from our culture, and all that. And beliefs can influence the way we interpret certain situations. For example, you may encounter a supervisor who treats you in a certain way, and the way you respond to that, part of it could be dependent on the beliefs that you have about what should be boss-reportee relationship. So I would say that beliefs would significantly can affect, our emotional intelligence and how we show up, how we deploy it, how we apply it. They can help us, facilitate us in our journey of emotional intelligence, or they can be obstacles. But the secret is to be aware, even about those beliefs, how they affect our EQ capabilities, and not to allow them to hijack us and all that. But please, Honorable Cicely, please feel free to deepen that. Thank you.
Vicky, you had something else for me, so I take both.
For now, you can take that. Well, actually, what I wanted you to take was the one about what is the role of emotional intelligence in going against bad political decisions that affect health adversely. And this is because you have been CS and PS Health and other ministries. And he says that decisions made are often tied to politicians who more often than not make bad decisions based on politics. Over to you, Cicely.
Thank you. Thank you very much, Vicky. And that's a very political question, I guess, because you said I'm also a political strategist. But clearly, Vicky, you are enjoying yourself in Nigeria because you're as it's 4:30. It is coming to 7:30 in Nairobi.
Oh my goodness. Sorry, I was telling you it's 4:30, yes.
No, Dr. Dirango, I think you've handled the question of beliefs and emotions very well. I think that the reason of my emphasis that we need to be very self-aware as the anchor to emotional growing or developing emotional intelligence is so that the more self-aware you are, the more you are also exposing yourself to the belief system that you may have acquired at the place of not being nurtured, or the place that you have walked through, where your life's journey has taken you so far. And therefore, just being aware of this and also sitting and interrogating and saying, okay, so where I grew up, we were taught to shout, for example, at the person who is not operating at the same level that we think we are operating. They are slower than us. They don't talk as fast as we talk. And therefore we shout and we dampen them and we say they are not quite competent. If that is a belief that we acquired because of either the organization where we were first employed, it means being aware that that is how you respond through enhancing your self-awareness helps you now as a leader to ask, is that serving you? Is that belief serving you or negating your interpersonal relations with the people that you are supposed to be showing up positively and role modeling to? And therefore you come and say, you desire to modify that behavior. And therefore you again go back to your emotions and appeal to your emotions. You practice and say, this is not it. Actually, next time this person is too slow around me, I will be empathetic enough to go around to them and say, how are you stuttling? How are you stammering before you answer? How are you looking shaken? How are you looking like you don't want to respond? I therefore deliberately modify the behavior or the response that I give in terms of belief that is not serving me. On to the question of the role of EQ, in as far as it can contribute towards modifying political responses that may not be serving us in the sector, if I was to paraphrase that, is to say that, again, I come back to the foundation of emotional intelligence is self-awareness. Leadership is about influence. So if you find yourself in a place of influence, that you can be able to influence either the policymakers or the politicians, and that you really are aware where your strengths are, it is for you to pull out your strength as an influencer, as a negotiator, as a good communicator, as a solid scientist, and be able to bring this and combine it into what I call emotional reasoning, and package it in a compelling story or conversation that can then be used either directly with your policymakers or your politicians or through third party to be able to begin also influencing them. It's been my dream, and Vicky, you know, for the longest period, that this discussion we are having with professionals today on EQ is a conversation that we are going to land at the doorstep of politicians and policymakers, because it is important they come and ask themselves, so are we being an enabler or a barrier? And they can only do this if they have an appreciation of where emotional intelligence, you know, contributes in terms of effectiveness to you as a leader. But unfortunately, again, research is telling us that you start the highest level of emotional intelligence, where you find it, where you find people wanting to nurture, to grow, to strengthen, is at the middle. And the more you move up the ladder, the more you move to be either the more senior, say a cabinet minister, it's seldom that at that level you actually think you need to strengthen anything, because the world again has given you this belief, which we want to also demystify, that out of 50 million, 55 million Kenyans, there are only 22 cabinet ministers in the Kenyan case, for example. That then gets into your brain to say that you must be extremely superior. You know what it is you know. And therefore, it will call for you to come and interrogate this which the society has put on you, to come and say, how do I still continue to grow as a leader, even though I'm a cabinet minister? How do I continue to role model, even though I'm a cabinet minister or a PS or a director? And it will take the power of leading with vulnerability, which is another whole different conversation that we can have at a different point. Vicky?
Thank you, Cecily. Thank you for that. To be really honest, if we were just to continue with this conversation, we can go on and on and on about emotional intelligence. But I will encourage you, all participants who are here today and attending this session, to subscribe to us, to our newsletter, because we continue to run these sessions every month as part of what Cecily and also Dr. Dirango mentioned, to advocacy, raising awareness, because it is only through raising awareness that we can start seeing some of these comments start to take root. For example, academia and non-academia finding a space with each other. How do we put these things in school? So we encourage you to please come and be part of the movement that is pushing to have emotional intelligence in all our curriculum. And healthcare is a big sector, and there are also other places. I would like to answer just one question before I call Honorable Cecily Kariuki and Dr. Dirango to make their final comments. And that is the question that has been put here on personalities, because I do quite a bit of work and I'm very interested in personalities. The role of personality plays in self-awareness, something that both speakers have mentioned is really critical in developing both your EI, adaptability, resilience, and so on and so forth. In fact, personality assessments help you in a big way, especially if you are going to receive them from without judgment, like a scientist examining what it does and how it makes you tick and what it makes you do. There's someone here who has mentioned and I will just say it as it is, that I'm a red personality, authentic, self-aware being, but often end up being labeled wrongly. So I like to say that self-awareness also is not just about understanding yourself, it's understanding exactly how people perceive you to be, because how people perceive you to be is really how they take you. So sometimes we have to take ownership of the narrative of ourselves that rubs off with others. And as Cecily said, is that really working for you? And that is now the beginning of accountability and total self-awareness, when we no longer excuse the impact that we're having on others, but actually interrogate it and ask ourselves pertinent questions. Simon Sinek said, start with the why. Start with the why, and then you'll be able to make a bit more intelligent decisions about yourself, the things you want to see change or not change about yourself, and you'll have better impact. But that is me preaching on self-awareness and the use of personality assessments. I would like to ask, and I will start with Dr. Dirango, to give us at least one or two remarks before we close this webinar that sums it all up, and then we'll end with Honorable Cecily Kariuki. Over to you, Dr. Dirango.
Thank you very much, Vicky, and also to highlight that I've also learned a lot from you and from Honorable Cicely. Yeah, it's an amazing learning opportunity for me. And the only thing I would like to say at the end is to encourage all of us, each of us, that where it is we are in life, at work, we are right there. We are children of the universe. It's about acknowledging that, embracing that, and asking, what do we do with that? Good or bad? That's a foundation that gives us the resilience we need. And just read one thing I've put down, that being logical, strategic, and results-oriented is important, and that's what we are taught to do. But it's not enough to lead effectively. Adding emotional intelligence to our leadership toolkits might be the key to inspiring engagement and collaboration in our teams by enabling them to manage stress, being able to coach teams, being able to provide feedback to colleagues, including adopting 360-degree reviews that our team members sometimes need to really understand themselves and to drive their own growth pathways. Thank you, and I look forward to being in another webinar to learn or to share what I know. Thank you.
Thank you so much, Dr. Dirango. We have learned so much from you, and you are such a deep reservoir of wisdom. It is such a pleasure to listen to you this evening. Honorable Cicely Kariuki, what are your parting remarks?
Thank you. Save for the reminder that should have come at the introduction point that I am currently the CEO and founder of a consulting company that is called Reimagine Impact Associates. I am all about emotional intelligence, coaching of leaders, training leaders, EQ assessments. And I want to encourage you, don't do it alone. We did it alone. We got burnt. There was no help around the corner coming. And therefore, don't follow the beaten path. Make it easier for yourself. I've seen a colleague who is asking, who is rather sharing that you are told, you people in the health space are told, don't bring your emotions to work. A very typical statement that you'd find in any other sector, because I've interacted with it. I've been served with that statement in the past. But like I said, inside 3 decades, emotional intelligence, the body of research that is backing up why it's a pivotal part, a critical component of effective leadership is now available. And therefore, for a supervisor who uses a language like that, perhaps there's a knowledge gap and they need to be encouraged, or how do you say, to be given a bit of feedback in a very polite and respectful way. But it will take you, who is being given that kind of feedback, to begin changing. Isn't Mahatma Gandhi who said, begin where you are at, make the world be what it is by doing your own little bit. Begin that change where you are. Just to say again, the ship has sailed, and I don't think that the emotional intelligence ship is going to stop. It is not stoppable, because the rest of the world, in fact, save for the African continent, it is quite embedded into day-to-day leadership aspects, because of its return on investment, because of its business case, and the studies again are there, because of team efficiency, team cohesion, productivity in whichever sector. Finally, for me to also say that indeed, if we are looking at harnessing the contribution of each and every one of us currently who believes in this as a good cause, we should be able to take off, and the momentum is going to be faster than we all imagine. And therefore, play your role, reach out, look for support where you can, and hopefully, by and large, I will be setting up to set up a training, a couple of days training program that we are able to delve into a lot of this practically with exercises and stuff like that. Working with Vicky, obviously, as we always do, and hopefully that you'll be able to sign up. Have yourselves a great night, and thank you for tuning in and joining us.
Thank you so much, Cicely. Thank you so much, Dr. Dirango. I have shared a link on the chat, and and it is www.jibu.africa. And I've also shared some little details about a recent survey that was done among nurses in 13 countries in Eastern, Central, and Southern African region. And that talks about some of the soft skills that are required for health workers. If you follow that link, it will give you access to what Jibu is all about, and it also allows you to explore some of the courses that are available on that platform. You will also be notified once courses on emotional intelligence are available to you. And for all the people who attended tonight, we are going to be sending a short survey. Please fill it in, because we would like to have your thoughts. Would like to know if this webinar met your expectations. I know we had quite a few that you listed down, and we are going to share that as well and look at it. Let us know who you'd like to be listening to during the next sessions or the next webinars, what you'd like us to improve on, so that the next people who listen in also really benefit and the webinars become more and more responsive. Let me thank you, Dr. Dirango, again in a very special way for coming forth and being part of this particular discussion. Let me thank you, Honorable Cicely, as well. Honorable Cicely runs a lot of programs as well in the healthcare space based on emotional intelligence. And she's actually a coach. And she's working with a lot of individuals to help them better themselves and be their next best versions in the healthcare space, in the leadership space. And well, generally, I know she does even more than that, but I'll leave it there. And to all of you, have a lovely evening, have a good night, and I hope to see you in the next session that we have. Thank you very much, and God bless. Good night.
Bye-bye. Thank you, Vicky, for being a great moderator as well.
Bye-bye.
Have a great evening.
Thank you.
Bye-bye.
Yes,
Thank you.
thank you. Thank you.
Thank you, Marvin, for your support.
Thank you.
You're welcome.